If you think the opioid crisis is over, local children and youth services data is telling us a different story.
Addiction is still a significant problem for women, pregnant ladies, and their babies right in our area. Our Lisa Adams is here with some hopeful information. Lisa, a major drug and alcohol grant is on the way to help addicted women, moms, and babies recover.
Good evening. That's right. Magee Women's UPMC Hamot is very excited about this. They applied and received a $600,000 renewable State Department of Drug and Alcohol grant to expand their 5-year-old recovery program for, as you said, pregnant women, babies, and parents, because the data shows the need is great. The new grant money for addiction recovery at Magee Women's UPMC Hamot is expected to make a big difference in a big problem. More than 300 case reports of substance addiction last year to children and youth services.
That was 300 out of Magee Women's at Hamot in the year 2021. It is not insignificant. It hasn't gone away.
But the gap between addiction evidence and treatment is wide.
In baby's urine, in maternal urine screen tests, in blood tests, in umbilical cord samples. So 300 discrete dyads, which is the mother and the infant, with evidence of opioid use or substance use, and yet less than a dozen were in active recovery programs.
The new $600,000 grant will make it possible for more local women to turn their lives around from fentanyl, opioid, heroin, or cocaine use by providing 24/7 wraparound services from doctors with addiction expertise to nurse and peer navigators and social workers to transportation and even childcare, expanding on the recovery work Magee Women's UPMC Hamot is already doing.
Women have turned their lives around. They've gotten jobs. They've gone back to school. They've improved their annual incomes magnitudes by graduating or getting a skill. And that's what the wraparound services are all about.
Magee Women's UPMC Hamot is right now hiring the doctors, nurses, peer navigators, and other staff for this expansion, which is really integrated into a woman's medical care. If the program gets good results, that state grant, which is from COVID-19 recovery funds, can be renewed for 5 years. So it's a potential $3 million investment in women's addiction recovery. Dr. Zazinski tells us more about Magee Women's programs and their clinical research at Magee Women's Research Institute coming up this weekend on The Insider. Live in the studio, Lisa Adams, Erie News Now.